Hi, I am Dr. Daniel Albertus. I am a board-certified ophthalmologist practicing at Kaiser Permanente in Northern Virginia. And I'm here today with my colleague, Dr. Farhan Merali.
Thank you, Dr. Albertus. I am Dr. Merali, a board-certified ophthalmologist, also practicing at Kaiser Permanente in Northern Virginia.
Thanks for joining Dr. Merali and all of our listeners today as well. We're very excited to be talking to you all about eye health, digital eye strain, how our eyes respond to using computers close to our faces for many hours every day, kind of like we're doing right now. We look forward to your questions. So if you're watching live now, please post them in the comments and we will try to answer them during our session today. And I think in the meantime, let's go ahead and dive in. Dr. Merle, I get this question a lot from patients. There's a lot of different people in the vision world, and most of them start with the letter O: ophthalmologists, optometrists, more detailed opticians, ophthalmic technicians, many different people. Can you just go over with us briefly the difference between those different members of the team and what they all do and who they are?
Sure, yeah, absolutely. Happy to cover that. So I guess for some basic background, and I didn't know this myself till I started, in the training process. So as ophthalmologists, we go to medical school with other types of physicians like cardiologists, general surgeons, pediatricians, etc. Then we complete a surgical residency, learning how to operate on the eye, as well as diagnose and treat any type of eye problem that should arise. Many ophthalmologists also do a fellowship that further specializes in a certain part of the eye, like the cornea or retina. And optometrists are also eye doctors, but they go to optometry school instead of medical school. So instead of a surgical residency, optometrists have the option to do an optometry residency to further their training in areas such as pediatrics or low vision. They can diagnose and treat many eye conditions and especially focus on providing glasses or contact lens prescriptions and doing dilated eye exams to screen for certain conditions or when a patient has new symptoms.
That's great. Thanks for that overview. Dr. Merali, can you also kind of specifically talk about how ophthalmologists and optometrists work together within Kaiser Permanente? I know there's differences within Kaiser versus outside. Can you just go into some details about the relationship that we as ophthalmologists have with optometrists and working together within Kaiser Permanente?
Yeah, of course. So one of the main advantages to patients in general who are within Kaiser Permanente is that we are all connected via our medical record system and we're all on the same team, working together to keep patients healthy and help them when a problem arises. And optometry and ophthalmology within KP collaborate all the time. In fact, most patients who see optometry also see ophthalmology and may even go back and forth to get what they need. Unfortunately, outside KP, there can sometimes be conflict and turf wars between optometry and ophthalmology, but within KP, the relationship is, I would say, mutually beneficial and collaborative, and that means patients win.
I think that's so true. That was my experience outside of KP, and also now that I've been with KP for some years now, I feel like that relationship is really, mutually supportive and collaborative, and that's really a great thing. As you mentioned, patients win. Do you want to just touch briefly on those other parts of the team too, the opticians and the ophthalmic technicians?
Yeah, absolutely, absolutely. So opticians work in the storefront portion of the vision department, and they help patients pick out a nice frame, make sure the prescription is going to work well within that frame, and also assist with measurements, adjustments to make sure that the new glasses fit on your face well and are comfortable. And then ophthalmic technicians can be thought of as eye nurses, in that they assist ophthalmologists with procedures in the clinic and are very involved with taking a patient's vision, eye pressure, other measurements, obtaining scans and photos of the eye that we as ophthalmologists need to treat them. And they're often the first person you meet when you have an appointment with an ophthalmologist or optometrist. And then within KP, all these four groups of professionals work seamlessly to help you see better.
That's great. Thanks for touching on those four parts of the team. I know that can be easy to confuse them. I think we've had enough background, and we had our first question about eye strain and especially middle-aged people, and I can certainly get to that in just a minute. I was going to next talk a little bit about how different categories of people, different ages of patients are affected by using screens and doing a lot of near work throughout the day. And the categories that I think of and what I talk to when I see patients in clinic are really three categories. One is the young children who, from as a young child all the way up to maybe through the teenage years. The middle category being someone who's in their 20s, a young adult, up through 30s, 40s, even 50s. They have different kind of concerns about lots of near work, like that question mentioned from Facebook, and I'll get to that in just a minute. And then the kind of the last category of patients that I think about kind of having other kind of issues with near work and screen time are the older patients, the patients who are in their 60s and over, are seniors. So let me just briefly talk about children and how children are affected by screen time and near work, and then I'll get to that question. So, children, when I think about young children, I have young children myself who are in elementary school. And just to touch a little bit very briefly on terminology, when we talk about nearsighted, for a child, that means they can see well up close, but if they look out the window or look across the classroom, their vision is blurry, so they can't see well. A child with this kind of situation may ask to sit at the front of the classroom because they can't really see the board very well from the back of the class. They might squint or try to do this to see clearly at distance. Someone might point something out on a tree or in the sky, and they don't really seem to see that very well. But when they're doing an up close task like reading or a screen, for example, they can see that easily and seem very comfortable. So that's nearsighted. We also call that myopia. And we know that for children, and really for children specifically, but for everyone, nearsightedness myopia is partly genetic and partly environmental. So genetic means a parent, two parents that are both nearsighted, probably going to have a child who's nearsighted. Not always, but usually that's the case. And then environmental means that a child who spends a lot of time doing near work is actually more likely to end up becoming nearsighted. We know that there's a lot of variation within groups of people, but it is more prevalent in people from East Asia. And the studies that have been done on this really measure two things, if you want to get into some of the technical details of this, which is, how long is the eye from front to back? You can imagine a ray of light going through the eye, starting at the cornea, the front clear part of the eye, and ending on the retina in the back of the eye. What's that length, that actual measurement? And then what's the glasses prescription? People who are nearsighted generally have a prescription that is negative. So it would be -3, -4, -5. And the studies look at the length of the eye and the strength of the glasses prescription. So if a child goes from a prescription of -3 to -3.5 to 4 to 4.5 over their childhood years, they'd be getting a stronger and stronger glasses prescription. And we know that kids who do a lot of near work actually end up becoming more and more nearsighted. Their eyes grow longer and longer, and the power of the prescription gets higher and higher. So we also know that driver is actually related to how far that task is from their face. So if they're doing something at arm's length, kind of like what I'm doing now, which is roughly arm's length away from me, is not as strong of a driver for a child as if they're holding something very, very close to their face. So now, why does it matter? You could say, well, the child just needs glasses and they can see well for the board in the classroom or looking out the window and playing sports, those kind of things. But we know that especially if a child becomes very nearsighted, a prescription of -6, -8, -10, they are at higher risk for things like detached retinas, glaucoma, early onset of cataracts, which are all potentially vision-threatening conditions. So there is a big push to how can we modify that risk factor and reduce how nearsighted children become through those kind of teenage years. The recommendations that I talk about and I think about for my own children or for your children, Dr. Merali, who I know are similar age as mine, spend some time playing outside, get natural light, focus that distance. That has definitely been shown to protect against becoming progressively more myopic and nearsighted over those childhood years. And then the other recommendation is that if you're going to watch a show, I know my kids come off the bus around 4 and they started school just last week, so they're kind of tired and hungry and maybe a little grumpy. And so they get to watch a show for about half an hour when they get home. I think it's a reasonable thing to do to kind of get things settled down as they transition back to being home. And so I had them watch a show on the TV as opposed to getting a device where they're looking at something very close. They can have a snack. They can, again, focus out a little bit further distance. And I think that's definitely been shown to be less of a driver to become very, very nearsighted through those childhood years.
Yeah, great tips and recommendations, Dan. I'll definitely, think about that more when my kids are getting their TV time. Yeah, so what about for adults, through their 50s? What kind of, recommendations and suggestions do you have for that?
Yeah, and I think this touches on the question that we had from Facebook, which is, what are the best practices for smartphone usage to protect eyes and about eye strain, especially with a lot of book reading, for patients who are in their 40s, and kind of how to avoid that. Yeah. And so thinking about moving into this next category, people from their 20s through their 50s, the eye shape and the length of the eye doesn't really change much. People don't become progressively more nearsighted if they do a lot of near work in those ages, unlike young children. Glasses prescription, usually pretty stable. Maybe you need to update every few years for some fine tuning, but in general, it's pretty much the same. However, for especially people in their 40s, like the question mentions, there's an actual muscle in the eye that contracts to change the shape of the lens inside your eye to help with that focusing up close. And if you do that for many hours every day, that muscle will get fatigued. And so I tell people when I see them in clinic who are experiencing this, if you go on a long hike and you go up and down hills and things like that, your legs are going to be sore at the end of that. If you go to the gym and you lift weights, your whatever you're lifting is going to be sore at the end of that. And that muscle inside your eye actually does become fatigued if you spend a lot of time doing near tasks. That can be screens, it can be reading. We know that muscle becomes kind of more and more weak, especially in your 40s and through your 50s. By the time you hit about 60, that muscle no longer can really change the shape of the lens. And with those older patients, and I'll touch on this in a minute, but with those older patients, they tend to wear reading glasses or progressive bifocal kind of a lens to help with up close focus. But for the middle-aged people, especially 40s and 50s, that muscle can no longer really change the shape of the lens as well. And if you spend a lot of time doing that, again, very close versus more like arm's length, that muscle becomes fatigued as the day goes on. And so I encourage people to do two things. Think about your setup, where you're working, whether that's at home or in the office. If you're doing a lot of near work throughout the day, try to have your setup such that things are a little bit further from your face. That allows that muscle to activate somewhat, but not to kind of do a max. You can think of like a max rep when you're lifting weights. It's some activation, but not as much as you can possibly do. The other thing that I recommend to patients when I see them and they can kind of talk about this is this so-called 20-20-20 rule. That's every 20 minutes, look at least 20 feet away for 20 seconds. And that allows that muscle to kind of relax and the eye to go back to its normal shape, the lens go back to its normal shape, and that can really help. The other thing is that more people are working from home now. If you have a break in the middle of the day, you could walk around the block for 15 minutes. That's going to be natural light, focusing out at a distance. Don't look at your phone when you're on the walk. Just walk and enjoy yourself for a few minutes and listen to the birds or whatever. That will allow that muscle to relax and might make your afternoon easier. And I think the last part of the question mentions what kind of daily habits do we need to adopt to kind of help with eyesight and eyes. And I think the big things are, for the middle-aged people, yeah, really taking breaks throughout the days. If you do 8 hours of up close focus, that muscle is going to be really fatigued. Patients experience that as headache, eye strain, headache behind the eye, feel like their eyes are very sensitive. Those kind of symptoms is kind of what I hear from patients in clinic. And so, take breaks, periodic breaks, set an alarm on your phone, for example, or on your watch. And if you can squeeze in a quick walk around the block, I think that's very helpful as well.
Great tips, Dr. Albertus. What about for our older patients?
Yeah, sure. So moving on to kind of into our last category. So young children worrying about their eyes becoming more and more nearsighted through those teenage years, middle-aged people having that kind of muscle fatigue, headache, eye strain, symptoms, and making sure that you adjust your workspace to be a little further from your face or take breaks throughout the day. Getting into the last category, the older folks who are in their 60s or older, we know that muscle and the lens inside the eye no longer can really focus for up close tasks. And so if a patient, let's say that patient is used to seeing very, very clearly at distance without any glasses, they might notice in their 40s, 50s, and certainly by their 60s, they're putting on reading glasses if they want to look at anything kind of within arm's length. So now if let's say you wore glasses to see well at distance when you're 40 or 50, now you're getting a progressive bifocal lens in your glasses. So again, as you look down, you kind of hit that bifocal portion, and that would help you with that up close focus. So patients who are in their 60s and 70s, 80s and beyond don't often have headache, eye strain kind of symptoms. They, because that muscle isn't really, and that lens isn't really interacting anymore in a way to help with up close focus. But their eyes can still get sore and tired and feel strained at the end of the day. And that's usually because of dry eye, as well as changes that we see with age associated with the oil glands around the eye. So we know from studies that if you're talking to someone or outside, exercising, doing something like that, you tend to blink a certain rate. And when you read or do computer, on the screen, whether it's a book or a screen, you tend to blink less. And every time you blink, what that really is doing is re-moisturizing the surface of the eye, the cornea. And so if you blink less because you're reading a lot, your eyes, understandably is going to dry out. I know you're going to also go into that in a minute, Dr. Merali. But just to briefly touch on the oil glands as well. There's oil glands around each eye where the eyelashes are, and they produce oil, and that oil is to lubricate your eye for when you blink. It's kind of like forming an oil slick over the liquid part of the tear that helps that liquid portion from evaporating quickly. And so the oil glands are not working well. When you blink, there's not going to be as much lubrication. Those tears are going to evaporate quickly. And so one thing that I recommend for older people who are having symptoms of dryness, of soreness or tiredness, especially with near work or screens, is it sounds funny, but put heat on the eye to let that oil come out of the glands and provide natural lubrication to the surface of the eye. And so there's products that you can buy, for example, these like sleep mask kind of things that have some gel beads in them. You can microwave them and put them on your face and cover both eyes. Patients often tell me that really just feels good. I actually encourage people, it sounds a little funny, but to take a sock and fill it up with dry, uncooked rice, just no water, put a few cups of rice in the sock and microwave it for about 30 or 45 seconds. And that certainly gets nice and warm. You can put it on your eyes, massage it around those oil glands, loosen those glands up. That oil will come out onto the surface of the eye and really provide, again, a natural lubrication, which feels good and will help with some of the symptoms. And then just one more question, I think, before we get into, before I pass it back to you, Dr. Merali. Are there recommended posture during, laptop usage better for the eyes? I think the key is, again, is arm's length. I think that's really important. So it's not such a close target to your face. And then also trying to position it such that it's about eye level with the middle of the screen. That way you're looking up and down a little bit, but your shoulders should be kind of relaxed and basically straight on as far as as far as the positioning relative to your eyes. So, and then I think at this point, why don't we pivot somewhat and just talk about specifically digital eye strain and how near work also kind of overlaps with dry eyes. I touched on that a little bit, but Dr. Merali, can you go into that a little bit more for us?
Yeah, definitely. Thanks for all those tips. So, as you mentioned, digital eye strain from prolonged use of electronic devices, it stresses the near vision in particular, because there are muscles involved in trying to see up close, including constricting the pupil, changing the shape of the lens, and the inward turning of the eyes. And so doing this for a prolonged period of time causes fatigue and even spasm of some of these muscles. And so as you recommended, moving out from your near work, taking a break, those things help. But as you touched on, the other problem with prolonged near work is that when people use these, computers or other devices, they blink less, but also less completely. So your eye doesn't close all the way sometimes because you're trying to focus and do something, you're trying to read or do your work. And so even though you're blinking, it's not a great blink, and this leads to the surface of the eye drying out. And so dry eye is a separate problem caused by this prolonged near work.
Yeah, and Dr. Merali, besides screen time and I know we're talking about digital eye strain and things, but what are the other causes of dryness that can that cause a lot of these same kind of symptoms that has overlap with excessive screen use, for example?
Yeah, good question. So, as you touched on a little bit, we produce fewer tears as we get older, and also the glands around the eyes start working less well. So they're making less oil, and sometimes they even get clogged, which is called meibomian gland dysfunction. So age is one factor. Hormonal changes in women, especially after menopause, can lead to dryness, which is why women are disproportionately affected. And then there are illnesses, especially inflammatory conditions such as Sjogren's syndrome, in which patients experience dryness elsewhere, like a very dry mouth, as well as rheumatoid arthritis, diabetes, and thyroid problems can all lead to dryness. There's environmental dryness, such as the use of air conditioning or heating. And, we're inside all the time, and these things, especially if it's blowing right above you while you're at work or at home, can dry the eyes out. Or fan use at home. Contact lens use can cause dryness. And so people may find over time they can't tolerate lenses as well as they used to. And then even certain medications such as antihistamines, heart medications, antidepressants, Parkinson's medications, sleeping pills, birth control pills can all cause dry eye. So it's important to work with your doctors to help figure out what kinds of things might be helpful to kind of treating this, and why working in a team, especially at a place like Kaiser Permanente, is a good idea, because we can all put our heads together to help. And currently, it's a widespread problem. Between 16 and 49 million Americans have dry eye, and it's hard to pinpoint because, it's underreported. We don't always know everyone who has dry eyes. But anyways, the point is it's a very widespread problem.
Yeah, and I think, before I mentioned for digital eye strain and that part of it for middle-aged people, that headache, maybe behind the eye, around the eyes being sensitive and sore. Can you go in, and I hear that from patients a lot. Oftentimes they also hear other symptoms that probably are more symptoms of dry eye, which I think interacts a lot with digital eye strain and fatigue with a lot of near work. Can you go into more of the symptoms of dry eye?
Yeah, absolutely. And so, you talked about that kind of pressure around the eyes and the straining feeling. Dry eye symptoms can overlap, but there is a little bit of difference. And some of the dry eye symptoms include a gritty or burning sensation. So burning is pretty indicative of dryness. Redness, feeling like something is in the eye. So some people say, well, I feel like I have a piece of sand or an eyelash. And we look and we don't see anything, and but we see the eye is very dry. Dryness can even cause watery eyes or excessive tearing, which sounds counterintuitive, and patients are always surprised when, when we bring this up. But this happens because your eyes are trying to, as a reflex, make extra tears in response to the dryness. And that's the only thing they can do quickly. They can't, squeeze oils out of the glands quickly, but they can produce tears. And so tearing is often a symptom of dry eye.
Yeah, I hear that a lot from patients too. My eyes are tearing. What do you mean they're dry?
Right.
And I kind of go through that same discussion about this is the body trying to do whatever it can to just fix the problem in that short moment. But in reality, it's a bigger problem that there's chronic dryness.
Right.
So what can patients do about dry if they have symptoms of, let's say, burning or even tearing? What can they do to kind of help with those symptoms and feel better?
Yeah, no, good question. And so I'll definitely talk about treatment, but actually before we talk about treatment, it's good to talk about prevention, which you kind of touched on, minimizing screen use, taking breaks, and moving whatever you are looking at a little further away, like arm's length. It can also include environmental modifications, such as the use of a humidifier in your home or office, especially during seasons when either the air conditioning or heating is on. Eye protection is also helpful, especially on windy days. Some people say, well, when I go out and it's windy, my eyes really tear up, and that's the eyes drying out. Goggles, if you work in a dusty environment, and eye protection can have a twofold benefit if there's some UV protection built in. But that's really important, and also prevents eye injuries, which we see a lot as ophthalmologists. Prevention also includes addressing systemic medical problems that could cause dry eye, or talking to your doctor about medications that could be contributing to dry eye to see if there are viable alternatives. And then in terms of treatment, the cornerstone of dry eye treatment is artificial tears. And so these are over-the-counter lubricating drops to help restore the moisture that's lacking. It is important to avoid eye drops that say reduce redness. And companies are good at marketing. If you have dry eyes and they're red, you want to get rid of the redness, and here's a drop that can do that for you. But what they don't put on there is chronic use of these can actually make the redness worse, because your eye, responds to these by kind of overproducing some of the receptors that the drops attack. And then without these drops, your eyes are even more red, and it's a vicious cycle. So avoid those. It's also important to use preservative-free formulations. Now, if you find you need to use drops occasionally, maybe a few times a week, a bottle of eye drops is okay. But if you find you're needing to use drops 4 times a day or more, which some people do need, then it's really important to use a drop that doesn't have preservatives. And it'll say on the box, preservative free, because these preservatives can actually exacerbate the problem. They're in there to prevent bacteria and molds from growing. Which is why the preservative-free formulations have come in a very small vial, so that you use it a couple times and it's done. And then if drops alone don't work, a thicker formulation like a gel drop, or even an ointment in the eye at night, it can be especially helpful if you wake up with dry eye or eye pain or have severe symptoms. And then, as you already mentioned, warm compresses on the eyelids can help open up those eye glands and stabilize the tear film so that, the eyes don't dry out as quickly.
Yeah, thanks for going over those. I think thinking about a hypothetical patient, let's say someone in their 40s who works in an office a lot, they listen to our talk or they read on the internet that that things should be positioned a little further from their face, and they do that. And maybe some of their headache and fatigue as the day goes down settles down. They take some breaks throughout the day, go on a walk, or even the 20-20-20 rule. Every 20 minutes, look 20 feet away for 20 seconds. And their symptoms improve. some of their symptoms improve, but they still have some grittiness and they have some burning. Maybe they have some tearing at the end of the day. They try the drops and they get some improvement, but they're still, kind of struggling. When I talk to patients about this, and I know the literature supports this too, when people's eyes don't feel good, it actually has a big impact on their quality of life. And patients often really can be quite miserable if their eyes hurt all the time or feel dry all the time. And so if they've done those modifications to their workstation, they got a humidifier, they're using drops, they're taking breaks, and their eyes are, they have less headaches, their eyes are feeling better, but they're really still impacting their quality of life. They focus on their eyes a lot because their eyes just feel bad. Can you talk about what kind of next steps are, beyond over-the-counter treatments, beyond workplace and other kinds of modifications that people can make?
Yeah, absolutely. And that's when you come to us. And, we unfortunately, there are groups of people who need more than what's available over the counter or what you can do on your own. And we can certainly talk through those treatment strategies as well. And Dr. Albertus, I think we're going to talk to you, he's going to talk to you about what are some resources you can look at for some tips. But at that point, if you've tried, what we're recommending, come in to see us, because there are other things we can do as ophthalmologists to help. So first, there are prescription drops that can help tackle dry eye, and you may have seen commercials or heard about them. And these include Restasis, Cequa, and Xiidra, to name a few. And these work by reducing the inflammation in the glands that produce the tears. And so they have been shown to improve both the quality and the quantity of tears that are produced, and can improve the lubrication on the surface of your eye as a result. And that's something we can prescribe. Tyrvaya is a newer medication and is a nasal spray that actually works by increasing the amount of tears that you make. And so it works in a slightly different way from the Restasis and Cequa and Xiidra, which are actually anti-inflammatories, and it just improves the production of tears. And then a lot of my patients have had success with something called serum tears. And these are lubricating drops. And it sounds a little strange when I first mention it to patients, but these are lubricating drops made from the serum component of a patient's own blood. So the patient, if I recommend this and they want to try it, the lab draws their blood, they remove the serum component. So they don't use the red blood cells, but they use this thin, clear yellowish liquid, and they mix that with some preservative-free artificial tears, and it's essentially a custom eye drop. And it contains a lot of the growth factors and other nutrients that commercially available eye drops don't have, but that can help with patients who have this severe dry eye, and even other eye conditions like corneal scrapes that aren't healing well. And so it's a very nourishing and helpful treatment for those conditions. And then there are other office-based procedures such as punctal plugs, and these are tiny silicone plugs that work kind of like a stopper in the sink. You put them in and they prevent your tears from draining as quickly, so they stay in your eye. Or amniotic membranes that the ophthalmologist might recommend to place in the eye if the patient is not getting relief from these other treatments, and that can help the eye heal while you're exploring other options. So these are a few of the things that we have, and patients often ask, well, will I always have to treat my dry eye? Like how long am I going to have to use this for? And I explain that dry eyes are a chronic condition, like high blood pressure or like dry skin. It may fluctuate, but will usually require ongoing care to keep the symptoms under control, whether this is a prescription or over-the-counter regimen.
Yeah, thanks for going over this, Dr. Merali. I think just echoing a few things that you said, a lot of patients who have been through a lot of different treatments and are still struggling with symptoms, I've used serum tears on them. And again, it's always a little bit of a interesting conversation at first that we're going to take your blood and turn it into eye drops that you put in your eyes. But patients uniformly feel a lot better with them. And not to say that other prescription drops like Restasis, for example, aren't helpful, but serum tears has been a really popular thing for some of my patients, and they felt like it was very helpful. Same with punctal plugs. I think, just to echo a few things that I think are really great for patients. We're kind of coming up on towards the end of the time. Do you want to just very briefly talk, because I think this comes up a lot from patients. They ask me in clinic, or even my family members that ask me, what's up with this blue light thing? And I always see these advertisements for blue light blocking glasses, or my eyes are gonna be damaged because of this blue light that's coming in from screens. Can you just briefly touch on that about blue light and whether it's really bad or not?
Yeah, certainly. And it's definitely a question that comes up a lot. But there's nothing inherently bad or damaging for the eyes, with blue light. So there are a lot of, ads about blue light blocking lenses, and some patients do feel like it's more comfortable. But if you don't have blue light blocking lenses and your eyes feel normal, you're doing fine, or you use artificial tears or something else that relieves your symptoms, you don't need to go out and buy blue light blocking glasses to help. There's no physical reason why blue light is any different than any other wavelength of light. So
and I agree with you on that too. I think there's no physical reason why blue light is bad or damaging. And I do find a more yellow tint is more comfortable. So I have that for my own screens. My phone in the evening, I think around sunset, my phone transitions to more of a yellow, they call it warmer color. And I find it's comfortable. There's some studies about circadian rhythms and sleep. It may be affected by blue light in the evenings. I don't know the data on that. I don't know how strong the data is on that, but I find it more comfortable, so I do it for myself. But again, I agree with you. There's no real blue light, nothing negative about blue light inherently. So
yeah, I completely agree, and I do the same thing with my phone. But yeah, I don't I have regular glasses. These don't block out blue light. But yeah, I see we're getting close to time. Dr. Albertus, do you want to talk a little bit about the resources we have for patients to learn more about eye health, and that they can turn to, as a first step when they're experiencing something?
Yeah, I think that's a great thing to finish on today. For all patients who have Kaiser Permanente, you can sign up for kp.org. That's your kind of your home base, so to speak, for things like looking up previous lab values, imaging results, like if you get a scan or an X-ray, you can see all the results there, which I think is great. If you need to, if you have a problem like a sore throat, you can complete something called an e-visit, which will allow to kind of walk you through some questions and triage some of what's your symptoms for that sore throat, and potentially get a strep throat swab ordered by. You can have it done at the lab. Those kind of things. And specifically talking about the e-visits, there's a whole huge number for them. There's one for if you're traveling, you can go on kp.org and complete this travel survey and have the necessary medications or tests ordered given to what portion of the world you're traveling to, which is really great because it's kind of formulaic in what you need if you go to a certain place, for example. And so we have an eye-related e-visit on there. And I think it's a great place to start for really almost any kind of eye problem. We have it be comprehensive in the sense that if you have new symptoms like your eyes feel dry, your eyes feel itchy, or you have a bump on your eyelid, you can go through that and it will help you triage what might be going on for you. It also helps people who just need to find their glasses prescription. The e-visit can direct them to there. If they want to order contact lenses, it can direct them to the right spot. So I think about that eye e-visit as a way of navigating our system, which I think can be confusing at times for people. And so I encourage everyone to go to kp.org and look at the e-visit section for really many conditions. That's a good place to start. The eye-related one, I think, is very helpful for eye-related conditions. On the e-visit and as well as kp.org, you can also self-book with optometrists. So let's say it's been 3 or 4 years since you've had an updated glasses prescription, and you're squinting or your glasses break or something like that, and you need a new glasses prescription. You can self-book with an optometrist to get a new prescription made, for example. So kp.org is a great place to start. And the e-visit that exists for the eye-related conditions is really a very great place that you can really triage you through anything. I also want to just highlight one other thing briefly, and that it's a new vision education website that has a lot of the information we talked about today, as well as information about conditions like allergic conjunctivitis, which usually flares up in the springtime or in the summer with pollen. If you have pink eye, like a child has pink eye, for example, if you have a bump on your eyelid, those kind of conditions, it gives a lot of information about how to treat those at home, and without having to come into the office. It takes your time. There's a copay. Often there's a wait. If you get dilated, you have to wait around for a while to allow your eyes to dilate. So if you can get treatment at home for one of those kind of lower risk conditions, it's just very convenient. So that website is kp.org/vision education/MAS, because we're mid-Atlantic states, Virginia, DC, Maryland. So kp.org/vision education/MAS. So encourage people to go there. A lot of great information. There's a really great video on dry eyes that's about 15 minutes long. It goes into a lot of the same detail that we went into today. And then just very briefly, I'll touch on a new program that's starting just next week. It allows patients who have conditions like glaucoma or glaucoma suspect, or maybe a family member has glaucoma and they're getting checked periodically to see if they get glaucoma, or a patient, let's say, who has dry macular degeneration that wants to check on their retina every so often to make sure that their dry macular degeneration hasn't turned into wet macular degeneration. We have a new program called the Eye Screening Program that allows patients to be seen by one of those ophthalmic technicians that we mentioned earlier, to get a scan and have an ophthalmologist review it within a few days and send a message with the results. So that would, again, no copay, no dilation, no appointment with an ophthalmologist or optometrist, but you can get the scans that you need to monitor your known condition kind of outside the setting of a traditional exam. So those things are all exciting. That's a new program. That's an exciting program. We have had more than 1,000 patients sign up for it already just in the first few weeks. So we're really excited about that. And also, like I said, just the e-visits on kp.org, especially the eye-related one, and that kp.org/vision education/MAS. So encourage people to check it out. And thank you so much for tuning into our live event. For health information like this, you can also visit kp.org/doctor. And from all of us at Kaiser Permanente, be well.
Thank you, everyone.